Good afternoon. Today is Friday, the 9th of April, 2021, and this is the English language summary at the daily press briefing here at the CCSA as always. So of course, we're in the Songkran or Thai New Year mood right now, but what is most important is that we have a safe Songkran. You can actually hashtag that online, safe Songkran. So just to start off with the general situation and the numbers that we have for today. We have new confirmed case standing at 559. Now the numbers have been this high for the past few days, as you know. We have new recoveries at 27 new recoveries, and making the active cases at the moment 2,645, as you can see on screen. Unfortunately, there is one new fatality that I'd be reporting to you today, making the cumulative total number of fatalities at 96. The newest fatality is a 60-year-old Thai male, Thai national, in Narathiwat province, who also who were suffering from tuberculosis as well. Now, just some observations from the information that Dr. Tuisin had briefed us just now. The current spread is scattered, of course, in several clusters right now in many provinces, involving many groups of people, but most cases are of the younger generation. And many cases were found in entertainment venues where people gather in an enclosed and crowded area without wearing masks, and some of them might have been using the same drinking glass as well. Now, there is one minor cluster, which had not been included in the number of cases for today as of yet. So this is the cluster from Uthai Thani province, the cluster from a folk drama or Like group. So the CCSA is aware of this information. However, it has not been tallied into the total number of cases for today yet. It's still being confirmed and will be in the tally next time. Now, Dr. Tuisin had mentioned about the meeting that the Prime Minister had with various sectors this morning, a very important meeting. The Prime Minister had a meeting with the Private Hospitals Association. They were one of the parties in that important meeting this morning. Now, the issue with them right now is that many private hospitals in Thailand are refusing to test people with COVID, or I shall say that they do not have the capacity to test people with COVID because of the lack of the solution, the lack of the equipment. But in fact, however, the supplies are still there. The main issue actually is that when a hospital finds a particular individual to be positive from COVID, it is understood that they must be admitting that particular patient. So that's the issue because of the lack of beds and the lack of facilities that would be in a number that is enough for the number of people who would be tested positive. So the Prime Minister had a meeting with this, and many agencies were involved to solve this issue. So the adjustments will be made. At the same time, the government will be increasing the number of beds in many hospitals, particularly those in Bangkok, as well as setting up more hospitals, as you recall, hospitals who are merging in with hotels, hospitals and hotels all in one, in order to supply the number of needed beds for those that need to be admitted and treated for COVID when they are found COVID positive. So they would not have to be admitted in the actual first hospital that they went to be tested. As well as, aside from hospitals, increasing the number of field hospitals as well. So that was the meeting this morning. Now, just to recap that about the closure of entertainment venues. So as we mentioned yesterday about the proposal to temporarily close entertainment venues such as pubs, bars, karaoke, and massage parlors in 41 provinces temporarily for 14 days. Now, the CCSA has already approved this proposal, and this closure of the entertainment venues in 41 provinces would be starting tonight at midnight. It will be effective tonight at midnight. This measure will be effective tonight and run for 14 days at least, and we'll be evaluating the effectiveness and the situation after that 14 days. So these 41 provinces were chosen on the basis of two main criteria. First is that there are provinces where new cases have been found in entertainment venues. These cases reported. Second criteria is that these are provinces with a high number of entertainment venues, the headcount, and or are located in major travel routes. So the 41 provinces, I won't be listing them all, but they include Bangkok and its peripheral provinces, the provinces of Phuket, Chiang Mai, Chonburi, Rayong, and Udon Thani as well, among others. This closure will not include restaurants. The temporary closure of restaurants, if a COVID case is reported, will be considered on a case-by-case basis and by zone as well. However, all restaurants, as we reiterated, stressed yesterday, all restaurants are advised to strengthen very rigidly their control measures against COVID. Now, the local, provincial, Communicable Disease Control Committee in each province has the authority to order further additional closures as well. On the issue of vaccines, just to touch on that a little bit, as it was mentioned by Dr. Thuisin. So with regard to queries about vaccinations, such as why at the moment we have only Sinovac and AstraZeneca provided, yesterday, the Secretary General of the Food and Drug Authority and the Director of the National Vaccine Center Institute of Thailand clarified that Thailand has no policy in restricting or limiting vaccine companies to import and register their products. The FDA has been contacted by up to 14 companies so far, and 4 companies have submitted the required documents. And out of that 4, 3 have been approved in addition. So these 3 are AstraZeneca company that has applied for the AstraZeneca vaccine, the Pharmaceutical Organization of Thailand applying for Sinovac, and Janssen Company applying for Johnson & Johnson. So that's approved. Now, the 4th one submitting has yet to be approved, still under process, is the Biogeni Tech Company applying for the Bharat Biotech vaccine. Companies that would like to import vaccines must have the appropriate storage and qualified pharmacists in charge so as to ensure that the vaccines are properly kept and maintained and remain in excellent quality until the day of its use, until the day of its inoculation. Some companies have also the policy to sell their vaccines to governments only, with the condition of no-fault compensation. This means that if any unexpected side effects occur after being vaccinated, the purchaser will not seek any compensation from the company. This is due to the fact that all the available vaccines now at the moment were developed within a shorter period of time than usual, which means that there are chances of unexpected side effects that will happen. Now, all vaccine producers can deliver the vaccines at the soonest possibility in the 3rd quarter of this year for Thailand's case, which is the same period that AstraZeneca will deliver its vaccine to Thailand. Now, there is that delay worldwide. In short, private companies can import vaccines but must fulfill the registration requirements. Just as one piece of information, anecdote, is that in Thailand, for example, we have been vaccinating quite a large number of people per province, but as you would know, nationally, the percentage is not that high, but we're getting there. I say in terms of provinces, as for example, in the province of Chonburi, just one province, in one particular day, for example, 10,000 inoculations, 10,000 people had been inoculated in one day for Chonburi province. But the national number, the percentage-wise, we're getting there. We're doing our utmost in terms of the vaccination plan, and as in the third quarter of the year, when the vaccines, full lots come, the vaccines arrive in Thailand and are being used. I think that that will be the time that our inoculation numbers will start to increase. So looking forward to that time. Now, of course, just talking about Songkran around the corner, which is next week. It's an auspicious time for us to get blessings and enjoy the festivities with family and friends. However, as the pandemic is still with us, we have to celebrate just like last year by refraining from hosting and joining in activities that would be too risky in spreading the virus. We hope to receive the same cooperation this year, which is next week. Please be informed also that the Bangkok Metropolitan Administration, or BMA, has cancelled all Songkran activities in all districts to curb Covid-19 from spreading further. This includes the Lan Khon Mueang Plaza in Pranakon district in Bangkok. And you have a picture up there on screen. Now, just lastly, Dr. Tui Sin ended with the quote from the Venerable Supreme Patriarch of Thailand as a blessing for the continued health of the Thai people. It's a very auspicious occasion for, during Songkran as well. And we're very honored to receive this blessing as Thai citizens, as Buddhists, from His Holiness, the Supreme Patriarch of Thailand. And the message in summary is that despite the various challenges, despite the various issues that we are facing, the hardships and the troubles, there is an expectation that we continue to take care of each other, that we look over many differences in our lives, and we focus on the sacrifice, we focus on the dedication. Of course, there is sorrow, there is pain of the loved ones that are lost, but with the sacrifice and the cooperation in society, that is what is expected, and that is what will make the difference in our society and make society a loving and caring society. So thank you very much for your attention today. Happy Songkran and happy Thai Family Day. Thank you. สวัสดีครับ